Hi guys, this is Dr. Mick here. Welcome to the Cat Muscle Lab, where we are going to first skin our cats and then we are going to go over the muscles of the cat with you. First, I'm going to talk about some external features that we have, which are on your worksheet. So the first term that we're going to discuss is the pinnae, and the pinnae are the flappy part of the ear. So here's one pinnae, and then on her other side, here is the other pinnae. The next term we're going to look at is vibrace, which means whiskers. So as you can see by her mouth, we're just going to take a look, and here's her whiskers. So those are all vibrace. Same with the ones that are on the top of their head. Cats get these cute little whiskers on the top of their head too, and maybe you can see if I put my glove against it. So those are all vibrace, which help with sensory purposes. I'm just curious as a veterinarian what this cat's teeth look like, so let's take a peek here. Definitely have adult teeth, and the teeth are looking pretty clean. I'm gonna try and peel. It's a little hard when they're stiff, but as you can see, there's no tartar on there. Her gums were looking healthy, so I assume this was probably a younger cat, but these teeth are beautiful. The next term we're going to move our way down towards the hind end is the anus. So that is going to be located right under the tail. So we have our tail. I'm going to get our probe, and then anus is right here. The next term on your sheet is a scrotum. That's not relevant with this cat, but make sure you take a good look at your cat as to whether your cat is male or female. Our cat is female, so she does not have a scrotum. The next term is the penis, which also does not apply to our cat because she's female. But the next term is vulva, which does apply to our female cat, and that's the opening, the outer opening to the vagina. So that vulva is right here, which is located under the anus. So it's ventral to the anus. And then we have mammary glands as our next term. Both male and female cats will have mammary glands. We can see her nipples. So here's one nipple. It's a pretty developed nipple, so she could be very probably pregnant or having recently delivered kittens with nipples of this size. Cats who have been through heat cycles will have nipples that are larger than cats who were spayed before their first heat cycle. So my kitty at home has very tiny nipples, so she was probably spayed early in life. But they do have a row on each side. There's another one. And here's another one. And when you have litters like cats do, it's important to have many nipples so that they can feed their young. As I said, male cats do have nipples. Several clients have come to me over the years and said, I found a lump on my male cat. What is it? I'm worried about him. And then we get to bring the good news that it's just a nipple. So no need to worry about it. So that's all for the external structures. I'm next going to show you how to make the first cut. Now you're going to have to skin multiple areas, even around the legs, around the head, but the cut I'm going to show you is along midline. Use your lab manual, and we can't emphasize that enough, to get a sense of where to make your other cuts. But this video's purpose is to just get you comfortable with making that cut and how to use your tools. So we're going to first open up our scalpel. So we're going to take this protector off very carefully. We're going to get some forceps. So I'm going to be pretending more or less that I'm doing surgery here because this is the most natural position for me. You're going to just try and get an area of skin with your forceps. It's difficult in preserved specimens because the skin is more tightly adhered to the muscle than it would be in you or I as a living specimen. So if you get a little muscle, that's okay, but you're gonna try and not hurt the integrity of the muscle, as we learned in the shark. because otherwise that's just going to ruin your visibility for those structures. So we want you to be careful, but not paranoid. So we're gonna make a small cut here in the skin with our scalpel. And I'm just holding it up as best I can. It's hard with these forceps, but to try and minimize my chance of getting the underlying muscle. So I have a small cut with my scalpel here. If you can see, I'll try and pull that apart. So you can see I just made a little nick with my scalpel. And next I'm going to take scissors and I'm gonna go in each direction. It does not matter which direction you go in first. I'm just gonna go down here. If you do have a developed female like this one, you will have mammary tissue next to your nipples and it will be more pronounced. So you may have a little pinkish tissue and that's just gonna be your mammary tissue. If you hold your scissors like how I have them here, you can dissect by pointing them inward. Instead of doing a typical motion like you would do with scissors up and down, you can turn your hand so that the blades are going to go horizontally, and this can help you break up connective tissue and separate the skin from the muscle. So here I'm going to use my forceps to pull up the skin, and then I'm just going to open my blade horizontally so that I can clear the path to feel comfortable making other snippets. So we're going to snip a little here, move our forceps, and then do more of this dissection. You can sometimes you hear a little bit of a noise with it as the connective tissue is separating. Do a little more. So it looks like we had initially probably cut into some of the mammary tissue. That can be unavoidable in these bigger guys sometimes. And we're just dissecting that out and making our cut along midline. And by breaking down that connective tissue, it's going to be a better time for separating the skin without ruining your muscle. Sometimes these older cats can also have some extra fat layers, and then that can be in your way as well. Any fat that we see is usually white and can sometimes look greasy, and we're gonna cut through that because we don't need that. As you can see, we are separating this pretty successfully on both sides. An example of the fat that I just talked about would be this. And you can see how it's white and has a greasy appearance, and that's gonna be fat. So with a mature cat, you're gonna see more fat. If any of you have smaller cats that are more kittenish, they're gonna have a lot less fat. As you make your skin flap, you can also start to break away the fat using your probe. So I'm just going to go right against the skin and get this out of the way. Cats have a pretty large subcutaneous space, which means that that's the space between the skin and the muscle that has all that fat and connective tissue. So in that sense, this cat is going to be a lot easier to skin than the shark because it's not those really delicate fibers coming up with it. So some of that you do have to be a little aggressive, but again, just be careful and make sure that indeed what you're working through is connective tissue. All right. So hopefully that gives you a good sense of what we're going to do here today. We'll be back in the next video with our cat muscles to review them. We are back with our skinned cat, and we're gonna go over our first figure of muscles. One point I wanted to make prior to going over that figure is that you'll see there's a lot of white fascia that's tightly adhered to the muscles, especially in this chest region, in the ventral thorax. So On your specimen, you should be able to see the striations much easier than what this video will pick up, but this video will still give you the general sense of direction of where those muscles are so that you'll be able to have a sense of where to look on your specimen. So we're going to talk about figure 6.15a first, and we have the numbers listed out for the ones that you need to know. And the first one we're going to start with, number 1, is the digastric. It's a bilateral muscle, and you'll see it over here. So here is our digastric. I had to take a little skin from the lower jaw in order to be able to see that one. Number 3 is the next one we need you to know, which is the masseter. Now, I didn't skin this cat's cheek, but the masseter is involved in chewing and would be on the cheek right here. We would like you to dissect that out, just cut a little further so that you can see the masseter. It's a pretty obvious muscle. Number 7, we have our sternohyoid. So I'm going to separate here so we can see a little easier. Our sternohyoid muscle is here. Number 8 is the sternomastoid. I'm going to lift the sternomastoid. It's a Y-shaped muscle. I'm picking it up with the probe here. And as you can see, the Y is a little difficult because when preparing the cat, they had to make an incision in the neck. But the Y shape is going here and here. So again, here is our Y, and I'm going to lift the sternomastoid. Number 9 is the clavotrapezius. That's going to be a lateral neck muscle that we are going to see here, the clavotrapezius. I'm going to skip ahead to number 14 since the clavotrapezius becomes the clavobrachialis when it reaches the arm. So that was number 14. Now we're going to go back to number 13 and look for the pectoantebrachialis, which I'm going to try and show you the best I can here is along this region. I'm going to cover the whole length of the muscle with my probe. This is the pectoantebrachialis. Next, we have the pectoralis major, which is here. I'm going to kind of outline where that would be. Our pectoralis major, so the pecs, as we would say for people. The number 17 is the pectoralis minor, which extends further down. And this is where we have our pectoralis minor. I'm going to skip to number 19, which is the xiphi humoralis, which we're going to see extend below the pectoralis minor. Again, I am going to lift that just like I did the sternomastoid. So here is our xiphi humoralis. And then lastly, I'm going to backtrack to number 18, which is the latissimus dorsi. We often see that attached to the skin. So when I flip our kitty over, we can see we have some muscle attached to the skin here. And it would have been further attached to the skin, now it's attached to the fascia, and that's our latissimus dorsi. It's not going to be one of those obvious bundles of muscle fibers, but we do see it attached to the skin, and you will notice that as you skin your cat. Now we are going to discuss figure 6.15b. So we have the numbers listed out, and I'm going to start on our worksheet with number 2. Some of these will be familiar. We just had you know them on multiple different figures. So, as we discussed before, here's our digastric. Number 28 is the sternomastoid. And if you'll remember, this is the Y-shaped muscle. And just like I did in the prior clip, I'm going to lift the sternomastoid. Number 27 is the pectoralis minor, which extends to here, our pectoralis minor. Number 7, we have the sternohyoid. Number 10 is called the subscapularis. Now that is not going to be visible based on this view. We would have to disarticulate our kitty a little bit, but we want you to know the location and to think about the name. For number 12, we have the biceps brachii. Number 14 and 15, we want you to know the general term, the triceps brachii. Number 18, we have the rectus abdominis, and this is a muscle that is going from cranial to caudal. I'll also show you with the probe, but it's not going to be this whole region. It's just going to be this center portion, and it's that top layer of muscle. The abdominal muscles have several layers to them, but what we're requiring you to know right now is that this top layer, and you'll be able to see the striations on your cat, going from cranial to caudal. That is the rectus abdominis. A fun fact is that in surgery, when we're doing abdominal surgery, this layer is our closing layer. So we need to make sure when we're suturing them back up that we get that first layer of muscle, the rectus abdominis, so that the incision doesn't fall apart and have organs falling out of our kitty. Number 20, as we discussed before, is the latissimus dorsi, which, as we had said, is often adhered to the skin, and there's still some remaining bits adhered to the fascia. Number 21 is the external oblique, which we can see well over this region. So here's our external oblique. Figure 6.16a is our next figure. We've covered most of these terms before, so you should know these guys. I think we've actually talked about all of them in the previous videos. We're going to start with number 22, the digastric, which again is present on both sides, but we've just dissected it out on one side. Number 21, our masseter, which is our cheek muscle. And we're going to have you dissect that out. You're just going to have to skin a little bit further. The pectoralis major for number 15 is found in this region. And you'll be able to see the striations better on your cat. Number 14, the pecto antebrachialis, which stretches all the way across. Pecto antebrachialis. Number 8 is the sternohyoid, which we know is going from cranial to caudal on the ventral neck. Sternohyoid. Number 9, sternomastoid, Y-shaped muscle, which I'm going to lift with the probe like I've done the previous times we have viewed this. Number 10, the clavotrapezius. I'm going to turn our kitty for clavotrapezius, which then becomes number 13, the clavobrachialis. That's all for this figure. Figure 6.17 is our next figure. So we're going to start with number 1, the spinotrapezius. You'll be able to visualize the striations on this muscle since it almost comes into a triangular shape. It comes to a point, which you'll be able to see. So here's our spinotrapezius. This side, it still has a lot of fascia, so it's a little harder to see on this side. Next, we have our latissimus dorsi for number 2. So again, that's just adhered to the fascia, adhered to the skin. We can see those little bits of muscle fibers. Next, we have number 3, our acromiotrapezius, which is going to be in this region. And we're going to see that a little bit more cranial than what we're going to see the spinotrapezius. Number 4, we have the spinodeltoid, which is going to come off of the acromiotrapezius. Here's our spinodeltoid. Then we have number 6, our clavotrapezius, which we've talked about before, but we're gonna see it from a slightly different view in this image because we're gonna start seeing it more from the back of the neck and as well as along the side of the neck like we've been seeing. Number 17, I am going to jump to because we know that the clavotrapezius becomes the clavobrachialis. And we're going to turn over our cat and go to number 7, the sternomastoid, which we know is that Y-shaped muscle. I'm gonna lift that like we have before. Number 10, we have our temporalis. So that's gonna be on top of the kitty's head. I'm gonna turn our cat and you'll be able to see that. We didn't skin this cat's head, but you would see it right around the region in front of the ear pinnae. And you know that this is the ear pinna because that was one of our external structures that we talked about. So we would have our temporalis muscle here. Number 12 is the masseter, which again would be the cheek. So over in here, it's gonna help with chewing and in terms of moving the jaw. Then we have number 19 and 20, which we just need you to know the general term, the triceps brachii. So we know that the triceps are on this side of the muscle, or on this side of the limb. And that's all for this figure. Figure 6.18a, we're gonna start out with the temporalis, which as we discussed in the last video, is going to be in front of the ear pinnae on either side. Number 16, we have the clavotrapezius, which we've talked about a number of times. We're gonna have our clavotrapezius. Number 15, we have our acromiotrapezius, which then becomes number 11, the spinodeltoid. Number 4/5, we have the triceps brachii. Number 3, we have the spinotrapezius. And then last but not least, number 2, the latissimus dorsi. Figure 6.18b, there's a number of new structures in there, and those are deep muscles. So right now we only have the superficial musculature of the cat exposed. So for this, we want you to know the muscle's location and we want you to know what they're deep to. You can feel free to try and dissect them out on your specimen if you would like, but we also don't want you to, to ruin too much of the superficial musculature. But for a practical, for example, it would be fair game if we asked you, hey, what is the splenius deep to? Or if we put a sticker on a bone and said, what muscle overlies this bone? And that would be one of the deep muscles, in these questions or in this worksheet. So this is fair game for the practical, and we absolutely do expect you to know these. Your lab manual will be your best guide in providing further information about those muscles. Figure 6.19 includes some of those deep muscles, but it is also a review of everything else that we've done several times in these other videos reviewing the muscles. So now we are going to go to some new muscles on figure 6.22a. And we are going to start with number 1, the sartorius. Now the way that figure shows, it shows the cat on her back here, but we can see the sartorius best if we flip our kitty over. And so we're looking at a ventral view, which is opposite of what the picture that aligns with this figure, but here is our sartorius muscle. And as you can see, the muscle belly does extend a little bit this way. There's fascia overlying, so it's a little harder to see. And that's where they're showing you in the diagram. But for a true better view of the sartorius and a good sense of where it is, I find the ventral view to be the best. So here's our sartorius. Then we are going to go to number 5, the biceps femoris. So I'm going to flip Kitty back to our dorsal view, and our biceps femoris is located in this region. Then number 12, we have the gastrocnemius, which is also known as the calf muscle. So we can see the calf. This is just a little bit of extra fascia here, and then our calf muscle for the gastrocnemius is right here. We're going to go to figure 6.22b. When we look at numbers 2 and 3, those are going to be the gluteal muscles. We won't be able to see those the way we have the cat right now because those are deep muscles, but again, we do expect you to know that where their location is on the dorsal side of the caudal end of the cat. So the dorsocaudal cat. Then we go back to our sartorius, which we will look at again. So we have our sartorius. And then we have number 9, our gastrocnemius, which is the calf. Figure 6.23a, we have another bit of a review with one new term that we need you to know. So for the review portion, we have number 1 is the rectus abdominis, which we know is on either side of midline of this cat, and that's our holding layer for surgery. The rectus abdominis right down the center. Number 2 is the external oblique. They are present on both sides. So for example, here is on the cat's right side. And then see if we can unfurl this kiddo a little bit. And the external obliques on this side, on the left side of our cat. And then we have the sartorius for number 8. Hopefully you know where that one is by now, because it's a nice big muscle that is pretty easily visible on the medial, so the inner side of the cat's hind limb. Then we have number 19, the gracilis. So this is a new term for you guys. And the gracilis is this other really nice big muscle belly on the medial hind limb of the cat. So the sartorius and the gracilis. And last but not least, we're going to end with the gastrocnemius, which is the calf. And we have that guy right in here. All right. So that is all. I hope you guys are studying and prepping for lab, because that will make it so much easier for you on the day of, as well as studying for the practical.